What we're going to do today is we're going to talk about two very specific technologies that Dr. Tom has begun to. What he does is he scours the earth for this cutting edge technology, sees what's working for other people and other physicians and other practices, and then tries it out on himself a lot of times, and then brings it into the practice there at Causenta. So Dr. Tom is going to tell us today about two specific pieces of technology that are really cutting edge for helping athletes, helping cancer patients, and really helping anybody with inflammation. Before we dive into those specific pieces of the technology, I would love for you, Dr. Tom, to tell us, there's always new things happening at Causenta. There's always new people or new patient stories or new technologies. And I would love to hear about the latest and greatest things that you're excited about at Causenta.
Well, in terms of new people that have joined our team, right now we have an amazing woman named Sherry that just joined our team. It's kind of a cool story. I hope she doesn't mind me sharing it because I did not ask her first, so I might get into trouble later. But her son was actually a patient at Causenta, and as what happens a lot of times is we get very close with the people and the families that come here. They're not just here for like an hour. They're here in many times weeks to months because they're dealing with very, very serious health issues. And we got pretty close with this family. And as it turned out, as I would say, to my good fortune, is that I was listening to Sherry one day speaking on the phone, and she was running her husband's office. Her husband is a chiropractic physician. And while her son's undergoing treatment, this woman's running a business and, kind of juggling 20 balls in the air. And I was like, wow, she's a superstar. So we started some conversations, and I was like, I would really like you guys to consider, joining our team because I could really see the skills you have really helping us grow in all kinds of other ways. And so now Sherry's been, I guess, part of the team for maybe a month, give or take a week. And things have been going really well. I'm still trying to recruit her husband. So I think very optimistically, and I'm pretty sure we'll finalize something and get him to join as well. And basically what Sherry does is sort of functioning as like our office manager / front desk person right now. And it's a really good experience because she's kind of lived the experience of having a loved one dealing with a very serious medical problem and understands all the difficulty in dealing with the medical system, the legal system, and the financial expenses and so forth. And, our goal is we want to help everyone we can, but we don't own everything. We don't own every lab, we don't own every drug company and so forth. So there's all kinds of obstacles and hurdles that we can't always anticipate until we start handling someone's care, and then this stuff just unfolds as you move forward. But what I'm really happy is that we've always been able to figure out a way to help people. So even when people don't have enough money, we can figure out ways to help them raise funds through like GoFundMe campaigns and other types of things to generate revenue for them. The other thing that we have, or other person, is that recently we had a young woman by the name of Zena that's joined our team, and she's I started speaking with her, maybe 6 months to a year ago. I don't have a good sense of time, so you can't hold me to that. And she's got really good energy, is going to really be important for helping people get on boarded and with us and understanding where to start and where to go, because we have thousands of options, and most people read stuff on the internet and they think, oh, I need that one treatment. They're not considering the possibility that maybe what they need has never been done before. Like that's just way outside their scope of thinking. And then another person that recently has sort of joined our team to help patients get onboarded is actually a former / current patient, a woman named Diane Donaldson. She's just a really amazing spokesperson. I have all kinds of stories about her just helping other people handle the stress of dealing with different types of cancers. And she's made it a lot less stressful and easier. And we were speaking one day, and I was like, I really would like to have you part of our team. So have patients that are now, you could say, employees of Causenta, because they've gone through the process. They've experienced the positive results that we tell people, hey, I know it looks kind of dark right now, and it looks kind of scary, it's overwhelming, but we do have a plan, and we can get you to the end of this dark tunnel, and you can see the light at the end. But just take some careful navigation, and you got to have a competent team, and that's what I feel we've created at Causenta.
That sounds pretty amazing, because there's a lot of people that have great experiences with whether it's a business or it could be a health clinic or whatever. Very rarely do they end up working there. So especially in a very serious environment when you're dealing with people's life and death situations. And so for three people to come through those paths and then end up working there, to me seems pretty awesome, and it speaks to what's going on at Causenta. Just for people that don't know and maybe getting this, this is shared with you, I want to share with you that Dr. Tom is the founder and CEO of Causenta Wellness and the Causenta Cancer Treatment Center in Scottsdale, Arizona. From working with NFL, MLB, MMA, world-class athletes, and even the White House, Dr. Tom's reputation of personalized medicine and cutting-edge technologies like the ones we're going to be sharing today have put him and Causenta on the map for caring for some of the most powerful people in the world, making Dr. Thomas Incledon one of the most sought-after healthcare professionals of our time. And so today we're going to specifically dive into some of the technologies that Dr. Tom has brought into the fold. And part of the recipe there at Causenta that we've shared over the years is, you have a mindset of getting to the root cause with Dr. Tom, and then you have a team with that same mindset. So he's assembling this amazing team of different people and different specialties and different kinds of doctors, and then the technology. And so today, I see you have a device there, and I know that it has, I've heard about lights. People buy these, LEDs are a big deal, and you see them at like Costco and Sam's Club, and they'll tell you how many lumens something has. This device that you have is called the multi-lumen, and I'm wondering how in the world a multi-lumen device can help athletes or cancer patients or people just with injuries in general. So maybe you could share with us just the general, idea of why this would even end up there at Causenta or any facility.
Sure, absolutely. So one of the first things I'll start off with is many people are still kind of misguided in that they're looking for a single treatment that can help a single condition. And that's a very outdated approach. There's been this movement over the last, let's say, 30, 40, 50 years that years ago we used to think treatment for a condition or treatment for a disease or treatment for syndromes along those lines. Today we know something like, for example, let's say if you have 10 people and they're all tired, they all have fatigue. One could have fatigue because they have poor sleep. They say they have sleep insomnia. Another person could have fatigue because they're low in vitamin B12. Another one could have fatigue because they're low in iron. Another person could have fatigue because they're low in testosterone. So how would anyone develop a single treatment for fatigue when you have all these different possibilities? It makes no sense. So in more contemporary views, we now focus on treating the person. So instead of me saying, so Matt, if you came in, you go, hey, I'm tired and I got fatigue. Instead of me saying, okay, Matt, you got fatigue, here's some B12, good luck with your life. That's the old school way of doing things. Yeah. Now we'd say, all right, let's see what's going on inside your body. Let's understand, well, hey, Matt, your B12 is normal. So B12 has nothing to do with your fatigue, but you got something else that's low that's involved in producing energy, and that could be why you're tired. So let's focus on addressing that. And then what happens then is when you kind of have more of a more thorough, systematic approach in evaluating someone, then the diagnosis no longer becomes as relevant because no matter what the label is, we're going to help you anyway. And where a lot of people are trapped right now, they're still under the misguided belief that they need an expert in their condition. But here's the harsh reality right now. we now have actual proof that every human being is so unique. There's no one like them, not only alive today, but ever in history of planet Earth. So how are we going to take data from other people and force it on your body? That's irresponsible. I mean, in my opinion, you don't force things on people. You learn from their unique physiology, and then you see what's the best fit out of the resources available. But many centers have a financial bias, meaning they're only going to offer you what they make money off of selling. Mm-hmm. Hence why, drug companies, a lot of other areas of medicine are very, let's say, overly weighted in terms of providing a certain solution when there could be less expensive alternatives available to help people. So today's technology, the reason why this has application to different types of, let's say, different groups within our population, is that it basically does two things. It increases the ability of our cells to make ATP. So specifically within our mitochondria, it activates an enzyme called cytochrome oxidase C. The purpose of activating an enzyme is we make more chemical energy. The impact, our ability to make more chemical energy within our cells is now we can improve recovery from damage. We can remove inflammation or inflammatory molecules faster. We can improve circulation. We can reduce pain. So think of it as one single event has an impact of thousands of pathways or ripple effects, if you will. So whether you're an athlete looking to recover from exercise or very aggressive training, or whether you're a cancer patient that's looking to help fight cancer, or you're someone with arthritis that's looking to get rid of joint pain or swelling in your joints, the same tool has application to all those areas.
So just to clarify, we're talking with Dr. Tom. This is the Ask Dr. Tom show. You can get episodes past, future, current at AskDrTom.com. And please share this with somebody that you love, whether they're going through arthritis or a cancer diagnosis or anything, because the mission of this information is to share this kind of mentality with everybody that's out there. But you mentioned drugs and surgery. Just to be clear, you're not demonizing drugs and surgery. They do fold into some of the treatment processes for individuals. I just wanted to have people understand this. It's not that you're saying don't do those things, right?
Yeah, so they definitely have a role. The problem is that it's like this. So a simple surgical procedure can generate $30,000 in revenue. Yet sometimes another option may generate $4 per month. So from a business model, what's a hospital going to push? Yeah. They're not going to push $4 a month. They can't sustain their business that way. And so the dilemma that a patient is stuck with is, how do they know they're getting unbiased, objective information? They don't. And Mayo Clinic published in 2012 that the financial challenges of the business side of healthcare is that the revenue generating aspects of healthcare have overshadowed, or they're more important now than patient outcomes. So in order to survive, large institutions are making decisions based on what generates more revenue as opposed to what's optimal from a biological perspective for that unique individual. So who's overseeing all this? There isn't a single, group or person overseeing these things. So I'm not saying don't do surgery or don't take drugs. What I'm simply saying is that it's incumbent upon the individual to get more educated as to what the best options are. But it's difficult right now because typically, if you go online and you Google something or search for something on Bing or some other search engine, the algorithms are such that what's coming up is marketing-based. It's not science-based. So the bias there is you're going to find information that visually biases you to make a decision that's based off of someone else making money off of selling you something, as opposed to like what's best for Matt's genetics and biochemistry and physiology, because that's really what you're looking for, is what's best for you. But you're not going to find that from a simple search. You're going to find something more biased.
And to sort of build on that, what you were saying about the individual when we first started talking is, so they have a sales process that often leads to maybe let's just say it's a $30,000 surgery, and that's a one-size-fits-all solution that people think is the solution for, let's say, breast cancer. So, and now they're looking at a breast cancer patient and they're comparing patient X, let's say it's Susie, to everybody that's ever had breast cancer before her, as though there's some consensus for all the breast cancer patients. And what you're saying is, I think, is what matters is not those thousands of other patients that have had breast cancer, but what's going on with Susie.
That's exactly right. So the way I would say people should look at things is, first, let's measure what's going inside of Susie, see what's there, and then based on those findings, then look at the research to see, given the fact that Susie has these markers that are high, what approaches, what treatments, what surgical procedures, what drugs had the best outcomes when you know that detail. What's happening right now is those details aren't being considered, and it's simply a one-size-fits-all. And since you mentioned the case of breast cancer, a good example would be, we see lots of women that get told they need to have their breasts removed and the ovaries removed and other parts of their anatomy. And then years later, they find out they have cancer in another part of their body. And what's missing right now is just common sense in medicine. You can't just remove body parts as a strategy to fight cancer, because there's no single test that tells you where cancer is all over the body that is 100% accurate. We don't have a technology that tells us real-time analytics for cancer cells. So if you, like, from your hair follicle to the top of your head, or maybe at my head, not too many hair follicles, maybe my bald spot, but all the way down to your toenails, there's not a single test that says, hey, we found every single cancer cell. So because we lack that diagnostic capability, how are you going to tell someone, hey, remove your breasts or some other part of your anatomy, and that's going to be good enough? That's a statistical model. But do you want to be a number, or do you want to be a human being? Right. Nobody wants to be a number. But what happens is people are conditioned, they're being conditioned to ask really dumb questions like treatment success rates and things like that, which is based on other people. And that's, where people getting led off course. The goal that most people should be focusing on is, how will you help me and what's going on in my body? Right. And then once you understand what's going on in your body, then you can look at data on other cases. But if you don't know what's going on in your body, the data you're looking at could be the wrong data, and you can make a very poor choice based on misinformation.
There's one more. I know we're going to talk about the multi-lumen and this technology, but one of the benefits of talking with Dr. Tom and being able to ask him questions is we often get little nuggets of information that when I hear them, I have an ear for this, and I want to just get it while we got it. You mentioned who's overseeing. There's nobody overseeing. When you're searching for medical information, or when you're searching for, what's the best practice for this disease or that disease, and people thinking they got to see a specialist and so on, you said there's no one overseeing this. And I think that was really profound, because I can't speak for everyone, but I think that a lot of people, patients, we think to ourselves like there's a council someplace, like of the supreme doctors, where they tell the other doctors, here's what we're doing and here's what's accepted this year. But there really is not much of that, right? There's like the World Health Organization, or, Harvard or whatever. They're all working independently. So there isn't really like the NFL of medicine, is there?
No, there's not. See, what happens is there's incredible financial bias going, pulling everyone in a certain direction, which ultimately means some large company is going to make some money, right? And unfortunately, what happens, though, is that let's say that right now you had an interest of helping, let's say, a group somewhere. You study that group and you find what you find. It may only apply to that group, but as other doctors learn of it, they may try with other people, but it may not apply to them at all, right? So that's like, it'd be kind of like this. Imagine if I measure the oil level in your car and it's low. Mm-hmm. And I say, Matt's car needs oil. And now I tell everybody, you have to put oil in your car, right? Because your oil level's low. And then someone would say, wait a minute, you never measured the oil in my car. And everybody would go, you're right. He never measured oil. And instantly, everyone would see that approach as flawed. But in medicine, that's never happens. It's like something new was discovered and everybody adapts it or embraces it because it's like the new finding, but they never question, does it apply to the individual in front of me? And all I'm saying is very logical. Just study the person in front of you. I mean, what I'm saying is nothing really new or revolutionary. Very observant doctors and scientists have been using this for years. And today in sports, one of the ways that a really good coach distinguishes himself or herself from, let's say, a poor coach is their ability to observe the individual. So you got, let's say, an elite track coach. He watches you run. He watches your running mechanics, or she watches your running mechanics. And they could see the difference in you're slow to start, or you have a short stride length, or you have poor turnover. They could see a mechanical challenge. And they know what to do to address your mechanical challenge, so now you're sprinting faster. But they don't do that same thing with every sprinter they work with because each sprinter has maybe different challenges. So it's that simple in exercise or in the sports world. Now we go to the medical world, and a lot of that stuff is totally just lost or ignored.
We're talking with Dr. Tom. This is the Ask Dr. Tom show, and Dr. Tom is the founder and CEO of Causenta Wellness and the Causenta Cancer Treatment Center in Scottsdale, Arizona. And this episode is about the technology, and it really is doctors and facilities like Dr. Tom and Causenta that will take something like the multi-lumen, for example, which Dr. Tom's going to share with us. And if you're looking for video of this and you're hearing it and you're just hearing the audio down the road, you can get the video and see more of that at causenta.com, causenta.com. But really what happens is doctors and the people at the facilities like Causenta will take technology like this piece of equipment and they will use it at their judgment and discretion to try and see what happens with patients and see if it helps other patients. And that's where the change and that's where the progress ends up coming from. So it's exciting here today to hear about what Dr. Tom is using this multi-lumen machine for and how it helps athletes, but cancer patients. So do you want to tell me anything about it? Tell us anything about it first, or do you want me to start asking you questions about it first?
Let me just give you some general pointers.
Okay.
And then we kind of go from there.
Yeah.
So first, this device, I've been dealing with, let's say, light-based therapies, for over 30 years. When I first got involved, it was introduced to me as cold laser. Then later on, the term was low-level laser therapy, and then light therapy. Then it was phototherapy. Since then, I've heard terms like photobiomodulation, photodynamic therapy, and there's like all these very long words or big words, if you will, or long phrases. And essentially, it just comes down to is we're using different wavelengths of light to reduce inflammation in the human body. And the way that we reduce that inflammation is by turning on an enzyme. Now there's different wavelengths, and some of those wavelengths may do other things like turn on or activate immune cells that may have antiviral properties, things like that. But today's device, it's a device that we apply outside the body. So think of it as, I'm going to turn it on, you'll see, it's just a light outside the body that goes on the skin. The light does penetrate the skin. So the lighter your skin, so guys like me that are very fair skin, it'll go deeper versus like my brother, who's much darker than me. It won't go as deep through his skin. And one of the reasons why that's important is the darker your skin or the more pigment you have, you trap more energy in the superficial layer. So a good doctor or therapist understands the difference in pigment and how that affects how deep the energy goes and gets trapped. So let's just say if my brother had a skin cancer that was deeper and I have a skin cancer that's the same depth, I might have a better chance of reaching that cancer with this light than on my brother because he naturally has more color in his skin and more pigment in his skin than I do. And that's important because that determines then, let's say if he tried it, he would say it didn't work for my cancer. But if I had to say in cancer work, as pigmentation of the skin can determine the effectiveness of this. But basically there's two wavelengths. One of the wavelengths is in a 600 nanometer range. The other one's in a 900 nanometer range. And you could think of it as the higher the wavelength, the deeper the penetration. The higher the wavelength, the better for pain management. The lower the wavelength, say around a 600, 650 range, that's better for getting rid of or for increasing energy of the cells. And as I turn it on, you'll see the differences between the two attachments. There's 4 ports here, and it's programmable. So I can determine the frequency that the light pulse is at. I can determine how many minutes that it runs for. For most people, 10 to 20 minutes is pretty good. I've used it with men with really bad plantar fasciitis. I haven't had any women yet so far.
Okay.
So this is when there's inflammation, let's say in the connective tissue on the bottom of the foot, to the point where just stepping down hurts them. And I would put these little black pads here. We get 2 and wrap them around. There's only 1 here now, but imagine you wrap it around the foot. So there's 2 of these connected, goes all the way around.
For people,
run it for 20 minutes.
For people that are listening, it looks like it's a little harder, but it looks like the thing they put around your arm to take your blood pressure. It's about that size, but it looks like it's a little bit more rigid. Sorry to interrupt, but just, for people that can't see, it looks like, so the control device is about the size of an old house telephone. If you're old enough to remember an old house telephone, it's about that size. And there's appendages that come off of it. And one of them looks like it's about the size of the device that they put around your arm to take your blood pressure, and it looks like it's got panels on them that are a little bit more, stiff. And so you're saying plantar fasciitis, you would wrap that around your foot, or you would wrap that around the patient's foot. So go ahead. I'm sorry.
No, thank you for clarifying that, because as I look into your eyes, Matt, you're so good looking. I forget the rest of the world can't see this.
Yeah.
So these LED bridges here, it's like a hard plastic, for lack of a better description.
Yeah.
This is where the light comes from, and then in between is this flexible material. It's like a neoprene sleeve, and then it's got like Velcro on the end, so you can lock it. And then the idea behind this is, as we wrap it around, it gets all the light, almost like, think of it like 360 degrees of light around the area we're trying to treat. So it doesn't matter if it was a foot or knee or a hip or even your waist. We would just put more of these in series until we get it big enough to wrap around the part of the body we're trying to treat.
Oh.
And you have all this light going in toward the center. So the idea is that's how we get maximal depth and penetration around that limb or that body part. And after about 20 minutes, we always tell guys, step carefully, don't push it, want to make sure you're okay. And we have guys running down the hall going, I'm healed. And I always laugh because I don't think you could truly heal damage in 20 minutes.
Right.
But they feel so much better. And a lot of guys claim they've never had an issue. So after one treatment, they claim they've never had an issue again.
With plantar fasciitis specifically?
Yeah, plantar fasciitis. So it's kind of comical to me because, I remember when I was younger, plantar fasciitis was pretty difficult to treat. Like, guys would deal with that for months, and now all of a sudden we have a newer technology, and in 20 minutes it's treated.
Wow.
It just seems comical in a way. Like, it seems like cartoonish, like it's too good to be true,
Yeah. So that's one example for somebody who's not diagnosed with the disease, plantar fasciitis. You mentioned arthritis. I'm reminded of, if people have it in their hands, and so I ride a motorcycle. I don't know that I have arthritis necessarily, but after a while, from gripping all that time, you kind of feel like, man, it feels like I need to oil my hands. So people that have that kind of arthritis in their hands, could they use this technology also?
Oh, yeah. It's actually, the hand is a really good example. We'll demonstrate later, but you could actually see the light So if you could see the light, so let's say I put the light on one side and you could see it on the other side, that's telling you light is going right through the whole limb, if you will.
Cool.
So the light is powerful enough, it goes through the whole hand. And so what's nice about this technology is we can make a sandwich, like I put two pads on top, and you can get incredible penetration. And we have a lot of elderly people that come in that have either neck stiffness and they have some hand issues, and they're at a point in their life where they're not ambitious enough to go and get MRIs and X-rays and all that. They're like, let me just try it, because like a single session will run maybe $50 to $150. So it's not like, depending on how much we're doing. So It's not, it's affordable for most people. So rather than going and making an MRI or an X-ray appointment and dealing with all that hassle, they usually just come in and say, look, let me just try one, see how I feel. And then typically they like the way they feel and they keep doing it. And then after about 3 to 6 treatments, they're good enough where maybe once a week or once a month, they can keep the benefits they have, so they can enjoy their life, ride their motorcycle or do their typing or whatever, crocheting or stuff like that without any discomfort. And it, allows them to keep doing what they want without any penalties.
It just sounds it almost sounds too good to be true. So you have athletes, plantar fasciitis, I could imagine muscle inflammation, all sorts of things that athletes go through. And then you mentioned seniors gosh, you don't even have to be a senior to be experiencing stiff neck and hand, carpal tunnel and some of those inflammation-like symptoms. How about people that have been diagnosed with any form of cancer? How does it work? You kind of touched on it a little bit with the skin cancer, but what other examples would there be of this helping a cancer patient?
So depending on the type of cancer, we have substances that have been tested or studied to be taken up by that type of cancer cell. So let's say if it was a skin cancer, there's different substances that people can either ingest. So think of that as we're using their digestive tract and then their circulation to get those substances into the cancer cells. And then depending on how superficial the skin cancer is, we can apply it topically to their skin. We'll let that substance get inside the cancer cell, and then we apply the light. When the light hits the substance, it's like the perfect combination of energy and mass, and it stimulates the substance to almost like explode like a grenade on the inside of the cancer cell. And that process is referred to as photodynamic therapy. It's something that I'll tell you that many, many people like because from our experience, there's almost they don't feel anything. They're like, are you sure it's working? And then they see the cancer disappearing, but they don't feel like there's no side effects like a hair loss or neuropathy or a heart issue or a brain issue. And there's nothing that's the more traditional side effects that you might hear from chemotherapy or something. So it's, in my mind, it's kind of like a really good fit for many people because a healthy immune system kills cancer cells and you never feel it. You don't feel this battle going on in your body. It's just happening. And a really good fit in terms of treatment or therapy mimics what happens naturally, meaning we're killing cancer cells, but you can't feel anything. So that way you could still live your life and enjoy your life. You're not trapped like a prisoner in your bedroom or in a hospital bed or, somewhere else because you're too tired or too swollen or in pain or something to do something you enjoy. And then what's nice about it is that it also gets rid of inflammation. So a lot of stiffness that people get from lack of use is now reduced. So it's a good fit for many reasons because it increases energy and it reduces stiffness so you can move better. And because we're very movement focused in what we do with people, because we understand that a lot of times when people have cancer or arthritis or diabetes or some other condition, let's say a heart issue, they don't move as much. And because they don't move as much as they used to, a lot of their health declines and they attribute that to the disease, but they don't consider that it's due to lack of use. So we use this tool as a way to help people, use their bodies more. And as a result, they see results even faster.
We're talking with Dr. Tom. This is the Ask Dr. Tom show. Dr. Thomas Incledon is the founder and CEO of Causenta Wellness and the Causenta Cancer Treatment Center in Scottsdale, Arizona. You don't have to be in Arizona to get help from Dr. Tom and Causenta. He's got a whole team of different kinds of doctors, so naturopaths, oncologists, and PhDs, and he's working on getting a chiropractor there is part of the team, and obviously adding on with the support staff. But you don't have to be there physically to get started. You can set up an appointment or a free call. Go to causenta.com, CAUSENTA.com, or you can call, I was going to say toll free. I don't know why I was you can just call the regular way, 480-883-7240, and set up a free call with the team there at Causenta, whether it's for athletic performance, just to get rid of pain, or if you've gotten a cancer diagnosis, you can definitely get some help that's customized to you. So, Dr. Tom, on the way here, I was listening to the radio, and I heard a commercial for some CBD thing, which I'm hearing CBD stuff all over the place. And you know, speaking to your financial bias thing, I mean, that is there's a lot of people that are spending a lot of money on that. They want to sell a lot of CBD. And I'm not here to knock it or not knock it. But when I hear about CBD, they typically talk about neuropathy. And I don't know what neuropathy is. So I'm wondering, first off, if you can share what exactly is neuropathy, because they keep saying that CBD is going to help with that. And for starters, I'd like to know what it is. And then I have another question about that.
Sure. So think of neuropathy as some sort of pain or tingling or numbness. It can happen any part of the body, but typically it's in like the fingers or the hands or the feet. It could be, you can have it like a diabetic neuropathy, which is the glucose that's in your blood that doesn't get metabolized. It attaches to the nerves or the neurons in your hands, your feet. And as a result, you start losing sensation. And then there's no feedback from those nerves to the brain. And now there's just like a constant burning all the time. And that can also happen from chemotherapy. So the drugs sometimes used to treat cancer, they can cause dysfunction in the brain. They can cause damage in the neurons. They can cause both. And so because of that missing input into the nervous system fills in that missing information with a signal, which, you know, you feel as burning or tingling or numbness. And for some people, it can be so painful to the point when they take a step, it's like they're stepping on needles. For other people, it's like their hands are constantly burning. So every time they move, it hurts. So it's extremely uncomfortable, and it gets intense over time. And typically the way it's managed, it's, usually managed with more medications. And the problem with that approach is that you take a medication, let's say you take a dose like 1x, the burning goes up. Well, now you take 2x, the burning goes up. You take 4x. So you're going down a dark pathway, meaning that at a certain point, you're not going to be able to take enough medication to counter all the burning sensation you're feeling or the pain signals you're experiencing. What's nice about red light is that it's repairing damage, and it's helping to regenerate some of the tissue there. So over time, you actually need less red light. So it's a better fit in general, because this could provide a permanent solution for some people. You can't see everyone. Now, in terms of the CBD ads you were listening to on the radio or driving in this morning, the challenge with CBD, it's kind of like a one size fits all. I've seen people, there's no standard for CBD quality in the marketplace right now. From a business model, CBD investments are great. You're going to have all these companies making absurd amounts of money on stuff that just simply doesn't work because there is no standard. So because there's no standard of what's good or what's not good, I can't tell you how many companies call us and say, you have a CBD product, and I go, can you send us some data? And they curse at me on the phone and hang up because they're calling a scientist. He's asking for data, and they're
Yeah.
getting upset with me. Well, why would you call a scientist if you don't have any data? That's absurd. Unless you want to fund a study, that'd be different. But not a single company I've encountered has actually done any real studies with people yet. But they're claiming based on anecdotal reports. And the danger with that right now is you're paying way too much. There might be better options already, like curcumin, for example, has way more data than CBD. It's just not the hot topic of the month, and so it's not getting all the attention.
So when you were talking about the traditional method for helping or treating the neuropathy and the drugs that they would be prescribed, is that typically an opioid, or what regular pharmaceutical would people typically be on that they have to keep taking more and more and more?
So depends on. So it certainly can be an opioid like morphine or codeine. It could also be other drugs like gabapentin. There's different categories of drugs. Some physicians are a little bit more savvy and understand that opioids in the end are kind of a dead end, because you get to a point where you just can't go beyond that. But you could make that argument about any drug. There's a range that it's been studied and been shown to work. And then beyond that, you're getting into a point where now do the risks associated with that higher dose, are they greater than the actual benefits to the patient at that dose? One thing I will say about opioids is that generally speaking, opioids work by making people not care about the pain.
Yeah.
They don't actually reduce the pain signals. And so what happens then is let's say if you were observing me and I was being treated by a doctor with an opioid, I could seem okay, then opioid wears off, and now I'm screaming in pain. And as far as you could tell, nothing changed.
Yeah.
So I appear like I'm crazy to you, right? How am I acting this irrational?
Yeah.
But what you can't see is inside the body, the way mechanisms work is that from our spinal cord, we have substances called inflammasomes. So when there's opioids present, it's kind of like we're telling our body, ignore the pain signal. So our body responds by turning up the volume. So it makes more inflammasomes. So now a greater intensity or greater concentration of these chemicals are produced. The result is now when opioids wear down or wear off, we got all this high levels of inflammasomes, and now we're in excruciating pain independent of a change in our structure. So meaning even when there's no damage, no additional damage taking place, we feel way more pain. And so that's why they tend not to be a good long-term strategy, because with each cycle, people tend to need more and more and more. Now, if it's somewhere near the end stage of life, like let's just say if someone had a very serious cancer that's progressed and the doctors don't feel there's treatment, that person's on hospice, then that might be considered a good strategy, or at least an adequate strategy, because they don't have much time to go. The problem, though, that people run into is that imagine if this was someone you love and they're in front of you and now they're, medicated on opioid. They get to a point they don't recognize you, or they can't control their bodily functions. And so it's not a very dignified way to pass. Or imagine, if this was your wife or your child, do you really want them passing away feeling alone? You want them to, usually we think of if someone we love is passing away, we want them to pass away feeling surrounded by people that love them and know that you're in our prayers or in our thoughts or something along those lines. That gets off the whole maybe spiritual aspect of things that might be beyond the scope of this podcast. But generally speaking, there's elements of that stuff that most people don't. In the beginning, they go with it because they don't know how the ending is. But if they knew how the ending was going to be, they would go backwards in time and say, I wish I didn't go down this path with the opioids. So that's maybe the best way to summarize that.
Well, and it to me, it sounds like hands down, it's at least worth investigating, trying something like the multilumin at Causenta and seeing personally how that impacts your condition. And then, if it does, wow. I mean, what a great path to go down. As you said, the more you use it, it seems like the less you have to use it. And that can lead to, just the guys with plantar fasciitis, for example, the feeling of not having that pain makes them want to run more. They feel invigorated. So that seems like a very positive outcome. We're talking about the multi-lumen technology. If you're watching the video at causenta.com with Dr. Tom at the desk, you could see the actual device. And I'm just wondering, Dr. Tom, what other ways that this technology can be created, this red light, the concept of light to reduce inflammation?
Probably way more gadgets or devices than we could possibly cover, just because there's, I don't know, there's hundreds of thousands of them. They all have a variety of different powers, if you will, or intensity, and that's just how much energy you could think of as coming out per unit time. One of the reasons why I like this particular technology is you could see one, when we turn it on, I have someone in the studio today we're going to demonstrate it on. It's really bright. It's very intense.
Okay.
There's no, at the lower wavelength, let's say around a 660 nanometers or so, or 670, there's no real heat from that. So if someone feels heat, it's really their own body heat being reflected back. So your heat comes off, bounces into this surface, and comes back to you. At the higher wavelength, it does generate some heat. And that what's nice about that is it improves microcirculation and things like that. Many of the technologies we've tested in the past, while they had the wavelengths were acceptable, the amount of optical power was too low to provide either lasting results, permanent results, or any results at all. So meaning like, while you have it on you, it feels good, but as soon as you stop it, oh, it hurts again, And so what I want, like in my mind, I want to fix you permanently so I never have to see you again for the same problem. But I don't know how long you've had this problem for. Let's say you came in, you have an issue with your elbow for 30 years. I'm probably not fixing that in 20 minutes, you know? Yeah. It may take several sessions. But if you just had it like brand new, my expectation is I should be able to fix it in one session, right? It's pretty new. There's not a lot of extended damage. But, work with individuals, we see some people respond very quickly and some people respond a little bit slowly because maybe there's other things going on in their body they just don't know about. So in terms of there are other gadgets that could generate red light. Most of the stuff you'll see like on Amazon or sold in stores, it's the power is too low to provide any permanent relief. But if you said, look, is it worth buying? As long as you can use it for lots of hours each day, what you could do is you can get enough energy over time. So let's say if you take something that's got 1/10 the energy of this, one argument could be made, use it 10 times longer, and at the end of that day, you got the same total energy. The problem is now is we need to sleep with it all night or wear it every, 8 hours a day, 10 hours a day. So you run into more practical matters that some of the low power devices you simply can't use as often as you might need to get a more permanent effect.
Plus, I mean, I've ordered like shoes or a shirt on Amazon, and it's, a lot of times it's not exactly what you expected.
Sure.
A device like that, I'd want to be going to a facility and using it, and then maybe if I had so many situations, or maybe I lived with 5 people, then we'd go in on the real thing. Like I would never want to get some halfway, version of that. It doesn't seem to make sense to me.
Yeah. Well, you brought up a good point there is that so years ago, when people would come in, the way we would treat it is kind of like you come in and we're going to work on you and then you feel better and then you go home. And then one day people start saying, I got like 3 boys and they're all into sports and they're always banged up.
Right.
And, I got to now keep going back and forth to a doc or sports med doc or somebody, a chiro, because someone's always hurt, and then I start thinking, wow, that's actually, it's clever, for that guy to think about his family in terms of an investment now.
Right.
And so now to your point, if you have like we tell everybody to be more active. And now the consequence of being more active, though, you also increase the likelihood you're going to have some injuries of some kind, right? Yeah. If you never move, you get other types of problems. But if you move a lot, then you have potentially could fall and get hurt. So one thing would be Well, you test these devices and you find one you like, and you say, all right, I'm going to have this at home, and you buy a few attachments, and now you actually have something with you all the time that, let's say you treat 4 or 5 family members, it pays for itself in maybe 3 months or less, easily.
Yeah, I mean, I see people doing that with those flotation tanks or with the cryo chambers and things like that, where they know they're going to use it so much versus the cost. It's just going to make sense at some point. So how do you want to? You're going to demonstrate the device.
Yep. So we have a male model in the audience today joining us.
And so what part of the body? I'll sort of.
Oh, you're fine like this. So what we're going to do is we're going to demonstrate this on. Hold on, I think my earpiece fell out. I forgot I have big ears. Sorry. So we're going to demonstrate this on Richard's right arm.
Okay.
And so what we're going to do is, can you see his arm right now
I can
in
see.
the screen?
Yeah, up to his elbow.
Okay, perfect.
So Richard's elbow, or elbow to fingertips, is displayed. Dr. Tom has the device, and he's getting ready to set it up.
All right. So what I'm going to do first is I'm going to show you. I'm going to take this. This is basically like the LED pad. I'm just going to wrap it around his wrist, and I got it set up so you can see it just velcros around.
Yeah.
I'm going to turn it on right now, and so I'll just show you. So the light is coming on.
Yeah.
And right now it's at an intensity that's kind of in the middle. And what I'm going to do is turn it up, and give me 1 second.
Now I see a flashing. So he has the it wrapped around his wrist, and there's.
Can you see how much brighter that is, Matt?
Yeah. It's got a flashing red. It looks red, almost with a gold in the middle of it. And then that other little mouse-like device is flashing also. So is that putting out the same stuff? Looks like an ultrasound.
So this has got
one.
more power.
Ah.
So because this has more surface area, think about the power is distributed over more area, just more concentrated. Just take a look at this and watch as I crank it up. I want you to see if you could tell the difference and how much brighter it gets. Could you see that through
you could see it. I could see it, especially on the one that you're holding in your hand, because your Causenta purple shirt is behind it, so it's kind of a nice backdrop.
And so now what I would do with this guy here, I could literally just apply it to, actually, Richard, if you don't mind holding that there, just apply it right on. You can lower your arm a little bit if you want. Can you still see his arm?
I can, and so there's two devices that come off of the main unit, and one of them looks like something that you would almost use to rub on for an ultrasound on somebody's belly, or
Right. So instead of sound waves, it's just light waves, right? Or light energy instead of sound energy. And so basically, what I'm doing is I'm treating his wrist, and I'm treating, let's say, his elbow at the same time. Now, what I could do is we have like these Velcro straps, and I could use a Velcro strap to attach. We call this whitish handheld device a blob. I can attach that anywhere I want in the body. Like a lot of times when people have like hip arthritis, I can put on the head of the trochanter. And then now it kind of like goes into the joint along the bone. And a lot of people say, wow, it feels really good. Someone has like medial meniscal pain. So in this case here, we think that he might have like something going on with an elbow flexor. So we could do is just put it right into the elbow joint. So I'm treating both ends of the muscles that cross that elbow.
Right. I could see this working like for somebody that plays tennis and has, they've got something going on with if they're right-handed, especially we're looking at Richard's right arm, and so he's got it's a purple panel that is like the blood pressure device around his wrist, and then the other blob, Dr. Tom calls it the blob, but it looks like a mouse, and the mouse is at the dent of his elbow, on the inside of his elbow, and he's just holding on there with 2 fingers. So it's not, and you can see the light pulsing. It almost looks like you're at like an EDM show or something, and it's just kind of pulsing to the beat, and it looks like it kind of. Oh, for a second there, it looked like it got faster, but maybe that was just an optical illusion. And so,
it's on a specific cadence.
If he's getting treated, let's say for like a tennis elbow or something like that, he's going to sit there for 20 minutes or so with like this.
Yeah, usually they're not in a studio standing, right? Usually they're laying down more comfortable.
Yeah.
And a lot of times after they do this, they look much better, the better looking that is. And so they usually want to come back. So the thing about this is usually I position in a way where they could either watch something on TV or they could read something on a tablet or their phone.
Yeah.
So it's kind of like they could be semi-productive, or get something educational at the same time to getting some therapeutic value out of it. And then typically, people say, wow, it feels pretty good afterwards. If not, we may look at some other types of therapies, like something with, I'll show the ARP wave a little bit later today. Specifically, people with neuropathy, we actually do the ARP wave and a multi-lumen at the same time. So we may put electrodes, and I'll show you this later, on the surface of their feet and then wrap the LED pads around the foot as well. So it's kind of like we're doing two therapies at once. And then depending on the individual, set walking with these therapies on their feet or on their hands or something like that. So if it was their hands, I try to have them moving their hands. If it's their feet, I position it where they could walk without stepping on LEDs, but still get the benefit. And then, one thing here, let me show you something. Let me see if this, so it's tough to see like this.
If you're just seeing the video and you're popping through this on social media, we're looking at Dr. Tom from Causenta, and he's demonstrating a multi-lumen technology that he uses to treat athletes and as well as people with maybe even arthritis and cancer patients. And it's a light therapy. This light therapy is used to reduce inflammation. So Dr. Tom just moved the blob, he calls it, but it looks like a mouse, and he just moved it to our hand model's fingers. And so he's holding it there. And so go ahead.
What I want you to see is basically how far the light goes. So basically, think if it is, if you could see the light.
Yeah, it's going through his fingers.
Yeah, exactly. Then depending on, the density of someone's, so you could see his hand here, there's very little coming through the skin.
Right.
Right. But let's say if it was like, say 100-pound woman, right, who has much thinner hands, you could actually see a light going through the entire hand. Now, in Richard's case, what we do is I'll put this down. The reason why then, if the light can't go all the way through, then the reason why I wrap something around it is because now I have 360 degrees of penetration, so I'm going to get much better coverage this way. So that's the whole idea behind covering it, versus like if I just did it this way, it's only going one way. You follow?
Yeah. Yeah. So when Dr. Tom holds the mouse, the blob on the patient's hand, you can actually see the fingers lighting up, almost like everything except the bone. Like I could visually see it just on video. It was lighting up everything, and it wasn't lighting up the meat of the palm. And so Dr. Tom's just explaining that, on a man, it's probably not going to push through that. On a smaller woman with a lighter woman that has tinier hands, it's you may even see that. And that light is what's working on the inflammation.
Yes.
And so now there's another piece of technology. So we're talking with Dr. Tom. This is the Ask Dr. Tom show, and that is one of like a few dozen different types of technologies that Dr. Tom has orchestrated throughout the labyrinth that is Causenta, which has this really amazing Olympic quality gym where you have, free weights, and you have machine weights, and you have all sorts of a circuit for people to exercise. And then there are rooms at Causenta there in Scottsdale, Arizona, where he's got technology. And some of them are the size of the room. Like there's that thing that looks like a tanning bed. This device that we're talking about today, the multi-lumen, Dr. Tom could pack it up in a carry-on bag and take it with on a business trip. I mean, it's very small. It would fit in a duffel bag. I mean, the airport people may be wondering what the hell it is.
Yeah, so it's funny you brought that up. So I was actually on my way to Canada, and I had a bunch of different gadgets with me, and I actually tore my medial meniscus, like literally in the airport. And I was carrying these different, pieces of luggage, and I was like, oh man, I tore my meniscus. So I'm trying to think, how am I going to walk across this? It was a pretty long distance. So I'll get a cart, and I'll just have them, I'll get in a car and drive me there, and then send, the luggage through and stuff like that. And so I call, And they go, "Sir, I'm sorry, we can't get you a cart." I'm like, "What do you mean I can't get a cart?" They're like, "Well, we're doing construction, and the width of the hallway is too narrow for the carts to go through. We can get you a wheelchair, but it'll take an hour for them to get to you in a wheelchair."
Wow.
And like, I can't wait an hour. So I'm literally hobbling through the airport carrying all this stuff. And so now I get to Canada, and I actually have a meeting with the CEO of this company. And while I'm there, I'm like, "I hope you don't mind, but I tore my meniscus. I'm going to treat it while we're having a meeting because my knee is swelling up." So you can imagine, you can see how the stuff glows red and all this. It's pretty bright. So imagine we're at like a dinner meeting, and I got my knee is glowing like a Christmas tree light bulb, flashing on and off. So the guy watches. I could barely bend my knee. Now we're done with dinner, and I'm walking fine. My knee's moving well. And he's like, "What is that?" And I'm like, "Well, it's this red light therapy. It gets rid of inflammation, and I use it, to treat damage in the body." He goes, "It looks like it works pretty good." I go, "It does." He goes, "Could you try it on my back?" And so he's now got it on his back. And so people are coming around us asking, like, "What do you guys got going on over here?" Because they see red lights coming from the dinner table. So anyway, he winds up buying a machine. And the funny thing about that was I didn't go there we were talking about something totally different, had nothing to do with red light.
Yeah.
But when people feel something that works, they naturally like, this helped solve a problem I have, and it's all here. Why waste time? Let's just conduct a transaction and get it done with,
Yeah, well, and the good news is the rest of us don't have to buy all the machines. Dr. Tom already has. They're all orchestrated and organized at Causenta. If you'd like to find out more about exploring just making your body feel better or treating something that you've been diagnosed with, you can call Causenta at 480-883-7240. 480-883-7240. Set up a free call. Just talk about what's going on with yourself and see where it goes. There's really no risk there. Or you can go to causenta.com, causenta.com. Looks like you were going to say something.
Yeah, you made me think of something that, a lot of times what I've been finding is I'm starting to see like a division between, let's say, so older people that come from a generation where like it was kind of like, well, I was healthy my whole life. I never went to see a doctor. And their definition of health is that because they never saw a doctor, therefore they were healthy. But by today's definition, we would simply say, well, they weren't healthy. They just simply didn't know what they had going on in their body. And because of the absence of information, they're misinterpreting that as health. And now they're in a situation where they're upside down, meaning they got, stage 4 cancer, they got really bad arthritis or something else going on. And they're concerned with the financial expense of fixing all the damage they have in their body. They're confused, like, how can I feel so good all these years of my life, and all of a sudden now it feels like everything's falling apart. And so they're stuck in this sort of mindset where they're afraid to do something because it seems like it's going to be expensive, but because they're not taking action, things are only getting worse, and as a result, becoming even more and more expensive to fix. And what they don't see is they're going to force themselves into a position where they'll be stuck and someone else will make the decision for them. So to make things really simple, one, we offer a free consult. It costs you nothing to talk on the phone. We have a bunch of different professionals you can talk to. What I would tell people is just get started. If you have a budget and, first you got to know what it is. If you don't know what you can afford, then it's really hard to know which way to go when someone says, do you want to do this or not? But if nothing else, you could start out with something simple that's like $50, for treatment. And then from there, you could decide if it works, great. You could stop there. If it doesn't work, you could decide, do you go forward? But the point is, a lot of times people kind of say, well, how much is it going to cost in the end? But no one knows what damage there is. It's kind of like, imagine if you totaled your car and you go to a repair shop, how much is it going to cost to fix it? And they go, I have no idea what the damage is. How could I tell you that number? I have to see the vehicle first. And then you say, give me a ballpark. And they go, well, it's going to be 30,000. They go, 30,000. I'm not coming in to see you.
Yeah.
but meanwhile, it could have been 2,000. But
right.
They don't know that. And so I just want to make sure people think of this, that Your health matters, and it's faster, it's cheaper, it's better, no matter how you look at it. Do something sooner versus waiting. One of the biggest things that I see right now that I have to work on in terms of my company's ability to help other people is to bring in more behavioral experts, because we have all the technology. We have amazing technologies. We have amazing, the doctors we have, I believe, are gifted in many ways. They're incredible. But despite having all these resources, a lot of people still say, let me wait, let me think about it.
Yeah.
And it's like, why would you wait when there's something that could help you right now, end your suffering? And it really, in the end, it really doesn't matter what it costs, because once you get through this, you could always make that money. But if you don't get through it, it doesn't cost you the thing. So for many reasons, it's better to take action sooner versus later. Now, in contrast with that, I'm watching all these younger guys that get it. I'm watching kids in their 20s and 30s spending money on their children, 4-year-old, 6-year-old kids that years ago, I never saw anyone do that. But strategically, what I'm seeing is very entrepreneurial, a visionary type of younger families. They realize that if I could do things now so my child is healthier, my child won't have to deal with the same issues I'm dealing with today. And I'm actually seeing people bring in their kids, under ages of 10 to get red light therapy for their joints and stuff like that. And I think that's very admirable because you could prevent damage when it might cost you pennies a day versus, when 10, 20, 30 years from now, when it's a lot more serious, it costs considerably more money in the future.
Well, I couldn't agree more. And the way for people to do that is by phone. If you like using the telephone, call Causenta at 480-883-7240, or go online without your phone, your computer. Go to causenta.com, Causenta.com, Causenta.com. And there's a form right there where you could set up your free consult. And to me, the ideal scene is you set up your free call, maybe find out some things that you could do wherever you are in the world on your own, whether it's supplements and exercise and so on. You get started. Then at some point, maybe you end up going to Causenta physically in Arizona. You make a trip. It's not expensive. It's and then you go in and you go through the facility and you use some of this stuff with the team there, and you feel something immediately from your experience that day, and then you're going to want to do it more. So it all starts with a phone call, and you could set that up at Causenta.com, Causenta.com. Now, we're going to be talking about this ARP wave technology. Do you want to take a couple of moments to set it up and maybe stand up and stretch and then restart a new session here?
Yeah, let's do that.
Okay, let's do that, and we will say not goodbye, but temporarily goodbye on this session of Ask Dr. Tom, and we'll fire up another one in a few minutes when we're ready to go to talk about the ARP wave. And is this a big thing? Just to tease it, is this it needs time to set up? Is it like the size of a room? Is it a small?
No, it's pretty small. It's a little bit bigger than this device, and it's portable.
It's a little bit bigger than the television-sized control, or not television, a telephone-sized control device Dr. Tom has with this multi-lumen. So we will talk and share about this ARP wave in the next video segment of Ask Dr. Tom.
So I'm asked all the time by patients, what's the difference between personalized medicine and traditional medicine? And in traditional medicine, there's a singular approach. So you have cancer A, and for cancer A, here is the standard of care treatment. And after you go through the standard of care treatment and it doesn't work, typically there's not a plan B. There's not another option. So then patients are told, hey, there's nothing else that can be done. And so then they're convinced that, hey, there's no hope and we can't do anything else. Now I want to contrast that in a personalized approach that we have at Causenta. We're going to measure all kinds of details within your body. And we're going to find lots of areas that we can actually improve your health. And then indirectly, by improving those areas, we're going to help you do a better job at fighting cancer. So where someone else would say, hey, there's nothing that could be done, we're going to say, hey, there's lots of opportunity here to improve your health. And make sure that you have a better quality of life so that you're able to function and live life under your own terms and not just waste away in a bed in hospice somewhere and watch everything go by you as time passes on. So if you or a loved one has been diagnosed with cancer and you're looking to get help, I strongly encourage you to go to Causenta.com and fill out the form at the bottom of the page and find out for yourself how we can help you.